You mentioned that you had a C-section in the past because you had twins and the doctor recommended that it would be safest to deliver them by C-section. And the incidence of C-sections when you're pregnant with twins is much higher because in most cases it is safest to deliver them by C-section, especially if they're not both head down. So you want to know, of course, it's a natural question, can I have a vaginal birth in the future? And the answer can be yes, depending on your circumstances. So here's the risk with a vaginal birth after a C-section or a VBAC. Once the doctor performed a C-section last time and made an incision on the uterus, they stitched it back up and chances are it healed nicely, but it's a weak point forevermore. And so next time you get pregnant and your uterus starts to get irritable and it contracts, especially during labor, your chance of having your uterus burst open is much higher. It's just like if I were to make an incision down my bicep and I started to lift heavy weights, you can imagine that that incision could rupture. So the chance of a uterine rupture is what it's technically called, while attempting a VBAC is 1%. So about 1 in every 100 ladies attempting a vaginal birth after a C-section have a uterine rupture, which is potentially life-threatening to moms and babies. But because the risk is very low, before ever attempting it, the doctor would make sure you knew any and all risks going into it. And then mothers and fathers can make the decision for their family, would it be best to try for a VBAC or not? So it would be best to talk to your doctor because they can give you the best information based on their knowledge of the specifics of your situation. But there's also something else you should know when doing a VBAC. It's best to have an epidural in place because your chance of C-section and the risk of uterine rupture is already way higher when you're doing a VBAC. And so having an epidural in place is actually one of the safest things you can do for you and your baby. If you had to go back for an emergency C-section, our alternative, if you didn't have an epidural in place to help control your pain, would be general anesthesia. And this is what you think of, this is what you'd think of if you had to go have your appendix out. This is what's given to you when we knock you out, we put a tube down your throat, and we breathe for you. But if we're doing this for you, obviously there's huge inherent risks in doing that, but it also poses risk to your baby because your baby gets that medication where they don't get the medication of the epidural. They don't even know you have it. It's very safe for them. But they get the medicine that's knocking you out and making it so we have to breathe for you. And so sometimes they're born and need to be fully resuscitated. So we don't like to do that unless we're in extreme emergent situations. So your doctor will probably recommend that you have an epidural in place when you attempt a VBAC if they decide that it's right for your situation. As for going to a midwife, it would be best to consult with the doctor who delivered you in the past and find out what their perspective is on that. You are now deemed high risk because you had a C-section in the past, you're wanting to attempt a VBAC. There are more complications that can exist, and a midwife is well equipped to handle nice, healthy, full-term pregnancies that are uncomplicated, but an OB is a specialist at taking care of patients who are high risk or more likely to have complications. If you have any other questions for me in the future, feel free to ask them on our Facebook page at facebook.com/Intermountain Moms and recommend us to your friends and family too.